So now that we're talking about vitamin D, let me jump in because that's one of the vitamins that I personally take. And I take about 2,000 units with some calcium. And I think my own personal opinion is that I think that we're spending more time indoors. We're behind computers more and we're not out there getting enough sun. And also there has been such sun phobia and so much about skin cancer and so much of these sunscreens that we're covering our skin and we may not be getting enough vitamin D. How much vitamin D is necessary and what do you look for? Is there a blood test that you check or how do you know if I come to you what I should be taking?
Well, this isn't rocket science yet. There's a lot of controversy about this. But I take a sort of a paleo perspective on vitamin D because, as you say, we have changed our lifestyles dramatically in the past few centuries. We're inside. We shun the sun. We used to walk around, like nature intended, without clothes in the sunlight for large parts of the year, and therefore we made vitamin D. In fact, that's the reason for light-skinned people is so that it permits the skin to absorb more UV light. So a typical lifeguard in the course of spending a day on the beach can synthesize up to 10,000 international units of vitamin D. So I think that some people may do fine on 2,000 to 5,000 international units. I never see toxicity even with such high doses.
So basically, I think what you need is like 10 to 15 minutes a day, 3-4 times a week, just exposing your skin, and you would get that kind of vitamin D if you're out in the sun. Obviously, as you get older, I think the cholesterol under your skin can be affected. You need sun to activate some of the receptors in order to convert to vitamin D3. Let me bring in another doctor. Dr. Goodman is also online. Dennis Goodman, who is also an internist, associate professor at NYU, and also a cardiologist. Dr. Goodman, good morning. Dave Samadi here. How are you?
Good morning, Dave. Good morning.
Well, thank you for being here. We're talking the entire show about vitamins, and which is very unusual for me to just cover one topic, but we got so many calls, and we also have Dr. Ron Hoffman with us, and we're talking about what's good for you, what should you be taking, and all the lines are people are waiting to be answered. But let me ask you something. I'm 48 years old, fairly healthy, but I have a very stressful career. I'm getting about 6 hours of sleep, but during the day, the level of stress, running a program, cases, etc. If I come to you, first of all, what kind of test would you get on someone like me, and what kind of vitamins should I be taking? I think I'm getting enough fruits and vegetables, but how does it work? What kind of tests and examination is being done right now?
So, David, that's a very good question, and it's hard to give a short answer. But I just want to say one thing. For me, I'm actually director of integrated medicine at NYU, and I get a lot of that kind of thing. So many people coming and asking me questions that they tend not to get good answers from other physicians, mainly because in Western medicine, we're really not trained well in nutrition and supplements, and yet there's a huge interest out there. And I have this feeling, and I tell all patients, wellness is not the absence of disease. To be healthy, to be well, you have to focus on 4 things. Nutrition, and that includes taking supplements when necessary, exercise and flexibility, stress management, and sleep. And I'm giving you that answer because it comes to something you asked, which is how much sleep should you get? And that's a crucial, very, very important thing to do for people to sleep properly. So I'm bringing that up because it's another whole conversation, but many people have sleep apnea and they don't get a good night's sleep, and then they fatigue during the day, and they stress even more than usual because they're so tired. Let's get to nutrition and supplements.